Hello everyone, I am Corey Keene and we will be discussing the causes of autism. The other members of this group include Allison McVeigh as summarizer, Taylor Braswell as summarizer, Paige Basham as fielder, Brianne Davis as researcher, Bianca Dixon as fielder, and Liz Russell as illustrator. The causes of autism are either genetic or environmental. Since there is not one single known cause to autism, it is important to know all of the possible causes. The causes we will cover are paternal and maternal age, prenatal and birth complications, biological causes, medications, and maternal and environmental factors. These factors have several pros that make it easy to believe they are concrete. However, with any pros there are cons. Allison and I will be presenting the pros and cons of paternal and maternal age. As a person ages, they have an increased risk of having a child who will be on the autism spectrum. The later a person waits to have a child, the more likely they are to have a child on the spectrum. The articles Advancing Paternal Age and Autism by Reichenberg et al. In 2006 and Maternal and Paternal Age and Risk of Autism Spectrum Disorders by Crone et al. In 2007 explore how parental age and autism are related. According to Crone et al., parents who are 34 years or older have a significant increased risk of having a child that has an autism spectrum disorder. According to Reichenberg et al., when fathers are 40 or older, they are 6 times more likely to have a child on the spectrum. Both articles discuss that this risk increases with every 10-year maternal and paternal age increase. Parental age can be a cause to autism when the parents are in their 30s or older. For example, I had a professor who has a son with low-functioning autism. He had a son when he was in his early to mid-40s. When he found out his son was diagnosed with autism, he decided to spend time researching paternal age and how it relates to causing autism. He is still working on this research, however it relates to both the Crone and Reichenberg articles. Next, Allison will be discussing the cons.
According to Reichenberg et al. 2006, they found that there was no relationship between both the parent's age and the children's risk of obtaining autism spectrum disorder in their study. There also wasn't any correlation between the parents in the study with increased age and bipolar disorder in their offspring either. Reichenberg et al. Stated that they couldn't account for other variables. This included things like the beliefs parents in the study had along with the environment. Just because there was an increased risk in the parent's age with a higher age, there wasn't actually a big group in this category. It also is inappropriate to say that a parent's age is the reason that their child has autism. This makes parents feel as though it was their fault that their child has autism due to the age they were when the child was conceived. Next, the visual will be presented by Liz.
In this visual, it shows the incidence of autism nearly doubles when the maternal age is over 40 years old. That number increases for paternal age of 40 or older. Next, Taylor and Paige will be presenting on the pros and cons of prenatal and birth complications in autism.
A study conducted by Brimacombe, Ming, and Lemondola, 2007, demonstrated statistically significant findings when considering several prenatal and birth factors, including uterine bleeding, and distinguished increases in what was labeled as the autistic group in comparison to national averages. The results from the study were in support of previous research in which findings indicated consistent associations with unfavorable events during a mother's pregnancy and/or delivery and the later diagnosis of a pervasive developmental disorder in the mother's child. In my own experiences with individuals diagnosed with an ASD, I have known multiple clients that have had reported unfavorable events during pregnancy, including bleeding, early contractions in pregnancy that were stopped, and delivery issues such as infants having the umbilical cord wrapped around the neck during delivery. This last situation described actually happened to one of my own relatives that was later diagnosed with an ASD. However, though such unfavorable events were reported with mothers of some clients, such events were not reported by all, or even the majority of those I have worked with in my own experiences thus far. Another element of prenatal and birth complications in connection with autism is that such complications are most often well documented in modern health settings and therefore present ample opportunity for additional future research to establish further potential connections or offer similar findings. With these types of studies, groups of mothers can be established and followed for data collection before a diagnosis of autism or other developmental disorder is ever present, eliminating potential for retrospective bias by parents, researchers, or other health professionals. In addition, studying such, most often naturally occurring events, does not place blame for diagnosis on any individual, and individuals are more likely to provide more accurate information to researchers regarding such types of events. Next page will be presenting the cons.
Birth complications are greatly affected by different factors, such as quality in hospitals, a mother's life choices, environmental factors, and many more. The study by Brimacombe, Ming, and Lemondola had a lot of these limitations in these areas that would be considered confounding factors, and therefore making the results invalid and not reliable. The participants in this study were only selected from a single population in northern New Jersey. The mother's lifestyle during and before their pregnancy was never observed or taken into account. As a result, the mother's health and life choices could have been the cause of their birth complications, or the reason why they had a premature birth. We have no way of knowing the conditions that the mother was in. Some mothers could have been smokers, taking drugs, drank alcohol, and other harmful substances. While some believe that prenatal and birth complications cause ASD, you have other moms who have perfect, healthy pregnancies and their child ends up being diagnosed. The data was also collected through self-report. So the researchers really had no way of knowing if the participants were telling the truth or if they were lying. The next visual will be presented by Liz.
This visual shows the percentage each risk factor has in relation to the occurrence of autism. As you can see, the highest cohort rate for autism is cesarean delivery, but the risk factor with the highest significance value is babies born prematurely. Next, Brianne and Bianca are going to discuss the pros and cons of biological causes in autism.
It is important to state that within the Ethical Compliance Code, behavior analysts and medical doctors alike must always consider the possibility of a patient or student with ASD also having other specific medical conditions or disorders. Behavior analysts have the ethical responsibility set forth by the Ethical and Compliance Code to recommend medical evaluation for the student should they believe that there is a reasonable possibility that a student's behavior is being influenced by a comorbid medical condition. Due to the fact that these comorbid conditions can greatly affect the overall functioning of the patient or student on their own, it is important for a family and for a behavior analyst to also diagnose or rule out any comorbidities before beginning ABA services. That was taken from Heatlers et al. In 2008. For example, a person with only ASD may function at higher rates than a person with ASD and ADHD, and the child with ADHD may more greatly benefit from treatment of his ADHD before treatment of his ASD. There are two ways that ASD can affect genetics within any given family: simplex and multiplex. According to Sanders in 2013, simplex means that there is only one known person with ASD in the family, and multiplex means that we have multiple family members with ASD. A multiplex family is believed to have chromosomal rearrangements that are higher in frequency, whereas in simplex families, mutations have been identified in proband. probands. A proband is a person that has been identified as the beginning family member of a family genetic study. Both of these can be very difficult to determine within families, which is particularly tricky when it comes to determining whether or not ASD is caused by deleted genes, mutations, or changes to chromosomes that have been passed on by parents. That being said, genomic testing has become available to parents and offers more information to parents in the way of what type of severity of autism their child may have. These genetic tests can help parents make educated decisions about treatments for their child as well. Microarray tests are used to identify copy number variants, or CNVs, which have been helpful in estimating the likelihood that a child will have autism. From IntegraGen launches ARIS Test, a genetic screening tool for autism in high-risk children, in 2012. However, testing has progressed, and now single nucleotide polymorphisms, or SNPs, are able to be tested, which gives a more specific and a clearer estimate as to whether or not the child will have autism. And that is also from IntegraGen launches ARIS Test, a genetic screening tool for autism in high-risk children, in 2012. This can give parents a greater sense of knowledge in order to make decisions that are best for their children at an early age, which is a striking advantage due to the known benefits of early intervention for children with autism. And now Bianca will discuss our cons.
On the other hand, although the ARIS test can genetically test children who are at risk for autism, it does not rule out children who are not at risk for autism. Another con of the test is that only licensed practitioners have access to it, and it can take up to 4 weeks to receive the results. Moreover, there is a strong genetic link to autism. There is an 18.7% chance that a child with autism will have a sibling with autism, 25.9% chance that the sibling will be a male, and 9.5% chance that the sibling will be a female, according to IntegraGen launches ARIS Test, a genetic screening tool for autism in high-risk children, 2012. Oftentimes, parents decide to stop having children when they discover that their first child is on the spectrum in fear of having another child with autism. Next, Liz will present the visual.
This visual gives examples of the different methods of fetal genetic testing. These tests are used to assess the fetus for chromosomal and genetic abnormalities, as well as detecting diseases or physical defects. The different methods used include ultrasound, amniocentesis, chorionic villus sampling, or CVS, and maternal blood testing. Next, Taylor and I will discuss the pros and cons of the increased risk of autism with medications. In a case control study conducted by Rai et al., it was found that 1% of mothers of the case children had been diagnosed with depression, while only 0.6% of the control mothers had been diagnosed. It was also noted that there was a paternal history of depression of 0.4% for both the case and the control groups. In the article, it states maternal depression was associated with an approximately 60% increase in the risk of autism spectrum disorder. The risk of autism makes a jump for the control group, whose mothers did not use antidepressants during pregnancy, from 0.6% to 1.3% risk for the case group of mothers who did take antidepressants. In addition, the antidepressants increasing the risk of autism in offspring, certain seizure medications taken by expectant mothers have been found to have an increased risk as well. In a study conducted by Christensen et al., all of the children born in Denmark between 1996 and 2006 were reviewed, and it was found that 5,437 were identified as having autism spectrum disorder. Of these children, it was discovered that 508 of them had been exposed to valproate, a specific medication used for epilepsy. For a child to develop autism spectrum disorder with prenatal exposure to this medication is 4.42%, It was also noted that mothers who took valproate during the first trimester increased the risk of autism spectrum disorder by 2.9% and childhood autism by 4.7%. Next, Taylor will be presenting the cons.
A case-controlled study conducted by Ray et al. 2013 also concluded that of the sample of mothers with depression using antidepressants during pregnancy, only 1% had a chance to have a child with autism. The statistic is comparable to the percentage of live births of children later diagnosed with autism in the general population, indicating that while antidepressant use during pregnancy could be a factor, it may not pose much additional risk in comparison to standard chance. It should also be noted that for some mothers, use of antidepressants and/or other medications may not be optional during pregnancy, or alternative medications or lack thereof may pose risks to the mother's health during pregnancy. Some types of antidepressants and anti-anxiety medications have potential for discontinuation syndrome and must be gradually reduced in dosage. So this must be taken into consideration as well as when a newly pregnant patient is discussing potential risks with their healthcare provider. The correlation was established by Ray et al. 2013 between certain types of antidepressants and a diagnosis of autism in the child. This relationship cannot be assumed to be causal in nature. An experimental design studies to test a causal relationship's potential existence would be unethical to conduct in most situations. Another significant point to note when considering medication use by a mother during pregnancy and a potential link to autism diagnosis is that searching for such links and presenting data to clients to link autism diagnosis searching for such links and presenting data to clients can be seen as placing blame and also does not offer much as to helping treat the diagnosis of the individual. Areas of competence should be considered and defined in these situations. Code 9.02 of the Ethics and Ethical Codes for Behavior Analysts, characteristics of responsible research applies to this situation. While it is the duty of the BCBA to remain engaged with current research and literature, medical studies may not always be in boundaries of our competence, and small sample sizes often utilized in such studies, as well as elements of retrospective bias, as mothers have often indicated medication use during pregnancy after the child's diagnosis is established, are at play. So it is essential to carefully seek out responsible research, as well as multiple studies. The next visual will be presented by Liz.
This visual lists the different types of medications used to control epilepsy. The hazard ratio for those exposed to valproate is the highest in comparison to the other medications listed. The risk of childhood autism is 4.9% with valproate exposure, as opposed to 0.9% with clonazepam. Now, maternal lifestyle and environmental factors, pros and cons, will be presented by Bianca and Corey.
Maternal lifestyle and environmental factors are also correlated to the risk of autism. Research from Lyle et al. 2014 shows that mothers who consume more supplements and folic acid during their pregnancy are at a lower risk of having a child with autism. In the beginning of their pregnancy, many mothers worry about changing their lifestyle while they are pregnant. Although it is not recommended to consume alcohol and smoke during any pregnancy, researchers have concluded that there is no impact of maternal alcohol consumption and smoking that is associated with the risk of ASD. In regards to environmental factors and the link to autism, according to Lyle et al. 2014, mothers are at a greater risk of having a child with autism when they are exposed to air pollution and matter. Thus, this can be prevented if they are cautious of their surroundings during the prenatal stage of their pregnancy. Additionally, there are other environmental factors that can increase the risk of having a child with autism, such as the season, maternal allergies, and influenza infections. In fact, There was a study done to examine reports of ASD diagnosis within the months of conception from the years 1990 to 2002 in California. During the winter months such as December, January, February, and March, more children were diagnosed with ASD than summer months like July and August. Corey will now present the cons on maternal lifestyle.
According to Lyle et al. In 2014, there has not been enough research to conclude that there is a relationship between autism spectrum disorder and other variables such as a mother's fat, nutrient, and vitamin intake. There are too many variables that can have an impact on the risk of an individual's development of ASD. There is an abundant amount of environmental factors that can also increase the risk of development. For example, a mother may live in a polluted area while she is carrying a child. It would be nearly impossible to pinpoint exactly which pollutant caused a child's autism. Lyle et al. 2014 also discusses that environmental risk factors are not exclusive nor unique to autism. Therefore, it would be difficult to prove that these risk factors are what cause autism. This relates to the Behavior Analyst Certification Board's Code of Ethics 9.02. Since it is hard to research these variables, any results could be misleading. When communicating with potential client or family members of clients, it is important to consider the characteristics of responsible research as defined by the Code of Ethics. Since research on these topics is lacking and different articles may present inconsistent results, it may not be ethical to present such data as fact to client and family members. Even such, it is once again important to also consider the role of the behavior analyst as focusing on treatment of individuals versus establishing or explaining causes of ASD. The next visual will be presented by Liz.
This visual shows the increased risk of autism during the different stages of gestation for different environmental factors and lifestyle habits of the mother. For example, traffic-related air pollution is a risk factor during the entire pregnancy, while the use of folic acid is only a risk factor during the first month of pregnancy. Next, Allison and Taylor will be discussing relevant ethical compliance codes.
BCBA Guideline Codes 1.02 Boundaries of Competence. All behavior analysts provide services, teach, and conduct research only within the boundaries of their competence. Behavior analysts provide services, teach, or conduct research in new areas, populations, techniques, behaviors only after first undertaking appropriate study, training, supervision, and/or consultation from persons who are competent in those areas. This code means making sure that they are skilled in that area before they are able to present or teach others. This relates to the articles because we aren't professionals such as doctors that have the right or wrong answers. So ethically, we cannot say that we know the answers of the cause of autism or what the cons of the articles are. 2.06 Maintaining confidentiality. Behavior analysts have a primary obligation and take reasonable precautions to protect the confidentiality of those with whom they work or consult, recognizing that confidentiality may be established by law, organizational rules, or professional or scientific relationships. Behavior analysts must not share or create situations likely to result in the sharing of any identifying information, written, photographic, or video about current clients and supervisees within social media contexts. Confidentiality for clients is very important to behavior analysts. Their job is to make sure that the client's information is always protected. Behavior analysts can do this by using password-protected files along with keeping reports locked in a secure database. This also includes avoiding dual relationships. It is important that behavior analysts know when to form that line between professional and friends. They should always stay away from adding clients and their family members on social media sites too. 2.07 Maintaining records. Behavior analysts maintain appropriate confidentiality in creating, storing, accessing, transferring, and disposing of records under their control, whether these are written, automated, electric, or in any other medium. Records of clients are to be stored appropriately and only seen by family or the behavior analyst. When clients are transferred or discontinue services, any file should be disposed in an appropriate manner as well.
Right. 2.08 Disclosures. A. Behavior analysts disclose confidential information without the consent of the individual only as mandated by law, or where permitted by law for a valid purpose, such as 1. To provide needed professional services to the individual or organizational client, 2. To obtain appropriate professional consultations, 3. To protect the client or others from harm, or 4. To obtain payment for services, in which instance disclosure is limited to the minimum that is necessary to achieve the purpose. B. Behavior analysts may also disclose confidential information with the appropriate consent of the individual or organizational client, or another legally authorized person on behalf of the client, unless prohibited by law. This code is what establishes behavior analysts as medical professionals with all of the same expected duties to clients regarding privacy and disclosures. Behavior analysts are professionals that adhere to strict lawful procedures regarding disclosures of information. Confidentiality and proper disclosures go hand in hand for behavior analysts, and maintaining proper records and disclosures is one of the ways that behavior analysts ensure the confidentiality of their clients. 2.09 Treatment and Intervention Efficacy. A. The behavior analyst always has the responsibility to recommend scientifically supported, most effective treatment procedures. Effective treatment procedures have been validated as having both long-term and short-term benefits to clients and society. B. Clients have right to effective treatment. For example, based on researched literature and adapted to the individual client. C. Behavior analysts are responsible for review and appraisal of likely effects of all alternative treatments, including those provided by other disciplines and no intervention. And then lastly, 4. In those instances where more than one scientifically supported treatment has been established, additional factors may be considered in selecting interventions, including, but not limited to, efficacy and cost effectiveness, risk and side effects of the interventions, client preference, and practitioner experience and training. The Treatment and Intervention Efficacy Code describes the primary responsibility of the behavior analyst to not only do no harm in treatment, but ensure that treatments are behavior analytic in nature and are demonstrating justification for their use, which should be recorded with accurate data, that they are targeting goals specific and relevant to each client. Lastly, 9.02, Characteristics of Responsible Research. Bullet C lists behavior analysts conduct research competently and with due concern for the dignity and welfare of participants. Bullet D designates that behavior analysts plan their research so as to minimize the possibility that results will be misleading. F, if an ethical issue is unclear, behavior analysts seek to resolve the issue through consultation with independent formal research review boards, peer consultations, or other proper mechanisms. H, behavior analysts conducting research take necessary steps to maximize benefit and minimize risk to their clients, supervisees, research participants, students, and others with whom they work. This code summarizes the role of the behavior analyst regarding conducting their own research, which must meet specific standards to be appropriate, but also determining appropriate research of others for purposes of dissemination and use in treatment for clients and evidence used to support families. It It also details appropriate guidelines for conducting research in terms of conflicts that may arise with other entities in the research process.
To conclude, we have discussed the pros and cons to several possible causes of autism. These include parental age, prenatal and birth complications, biological causes, medications, and maternal lifestyle and environmental factors. Each of these topics has several different pros and several cons. However, there is not one single known cause to autism, and there are ethical implications when considering the causes of a diagnosis and acting as a practitioner for clients in behavior analysis. Next, we will be answering some questions.
What is the main cause of autism?
The main cause of autism is unknown. Although there is no main cause of autism, there are many different risk factors associated with autism, such as environmental factors, genetic, and brain development.
How prevalent is autism?
According to Tanachi et al., the prevalence of autism is the same no matter the child's race, ethnicity, or origin. Autism is found in 1 in 68 children in the United States. It is more common in boys than girls. 1 in 42 boys in the United States have autism, and 1 in 68 girls are diagnosed with autism.
Why is autism more common in boys than girls?
Research shows that teachers are more likely to coddle girls compared to boys, and girls are more likely to be lower functioning when they are found to be on the spectrum.
How early can autism be detected?
Autism can be detected as early as 18 months.
What are the 3 main conditions referred to as autism spectrum disorder?
The 3 main conditions referred to as autism spectrum disorder are challenges with social skills, repetitive behaviors, and communication. There is not one type of autism, but many different ones caused by a combination of external and internal influences.
Does consumption of medication from the father increase the risk of autism spectrum disorder?
There are actually not many studies that focus on fathers' intake of medicines causing autism. However, there was a study that researched about fathers and antidepressants. Results showed that there was no evidence of correlation between depression in fathers and ASD in their offspring.
And lastly, here are our references.
Is there a cure for autism?
There is currently no cure for autism, but certain treatments can significantly reduce the effects of ASD. And that concludes our presentation.